I think it's still a source of debate. There's moderate quality evidence that immunotherapy can prevent asthma development when it's given to children. I don't think there's any equivalent evidence in adults as yet. The evidence in children dates back to a number of studies that showed that early treatment with immunotherapy could prevent development of asthma later on, and a more recent study which looked specifically at use of sublingual immunotherapy with grass pollen to see if that could prevent asthma development. And while that study missed out on its pre-specified primary endpoint, there are a number of secondary endpoints that looked very encouraging. So I think there's definitely a potential, but we still need a single study with high quality evidence in order to put a final stamp on that statement.
Well, SLIT sublingual immunotherapy has been developed during the last 10 years mostly, and we do not have very good evidence that SLIT for rhinitis would reduce asthma symptoms or stop asthma to develop, but there are some studies which seems to show that this may be the case, at least some of the patients.
At this moment there are several trials, certainly with house dust mite, showing that we should really take allergen-specific immunotherapy as a serious treatment for asthma. Of course, it's always important that before you start any treatment that your patient is already under control with the classic asthma medication, so with inhalers. But if you then build up with SLIT, you can release the dose of the classic inhalers. So I think it's a good option and certainly a long-term option for the patient.